Bonjour à tous. Whether it's to cover the bills, to keep people on the payroll, or to make rent on a storefront, many Canadians need a hand right now. So over the past few months, we've brought in new programs that are doing exactly that. Just take the wage subsidy and what it has meant for people like the employees at Euroline in Oakville. This family-owned appliance business had to close their operations and lay off staff because of the pandemic. It was a really tough spring. But when they applied for the wage subsidy, they were able to then rehire their entire team. And that matters to the 22 people who now have their paycheck again. To all employers, please use the wage subsidy if you haven't already. This help is designed for you and your employees, and if you need more support, apply for the Canada Emergency Business Account. On the CEBA in particular, I want to remind everyone that we recently expanded the eligibility for this program to include even more small businesses like farmers. The new application process will open on Friday, and in the coming days, we'll have more information to share about it. For now, though, you can go to edc.ca for information about the documents you'll need to apply. In the last few weeks, things have started to look up for a lot of people. But that said, we also know that far too many Canadians are still struggling. If you're having troubles finding a job, you shouldn't also be worrying about whether you'll hit the limit of your CERB benefits. So right now, we're working on a solution to extend the benefit for people who can't return to work yet. We'll have more details later this week, but for today, I want you to know that we will continue to be there for you and your family. Au cours des dernières semaines, les choses ont commencé à s'améliorer pour bien des gens.
Getting better for many people. Having said this, we also know that too many Canadians are still having difficulties right now. If you are having trouble finding a job, you shouldn't also worry about running out of eligibility for the Canadian emergency benefit. We are trying to find a solution to increase the benefit period for those who still cannot go back to work due to the pandemic. We will have more details for you this week, but for the time being, I want you to know that we will continue being there for you and for your family. On this, I would like to take a moment to recognize and pay a tribute to all the civil servants who have been working very hard for weeks to make sure that Canadians get this emergency benefit and the emergency wage benefit. During this National Week of Public Service, I would like to thank them for everything they have been doing for us, especially during this pandemic.
National Public Service Week. I want to thank all the women and men who work incredibly hard to get Canadians the help they need. Especially recently, they've done a remarkable job for their fellow Canadians. No one could have predicted that this spring would turn out the way that it did. Certainly for farmers who keep our grocery stores stocked and our families fed, it's been an unexpectedly challenging few months. With restaurants and hotels closed for weeks, many producers were left with extra food they couldn't sell. Farmers work hard to raise their livestock and grow their crops. They shouldn't be in a position where they have to see that wasted. And that's why today, we are opening applications for the Surplus Food Rescue Program. This program will help get products that farmers and fishers can't sell, whether that's potato, poultry, or seafood, or otherwise, to communities that need it. People across the country will benefit, including in remote northern communities. This is a win-win. Farmers will have people to buy their goods, and food will get to the plates of families who wouldn't have enough otherwise. Aujourd'hui, on lance les applications pour le programme d'achat des aliments.
Application for the Surplus Food Program. Because of the pandemic, many Canadian farmers have not been able to sell all of their produce or meats, and it is a great pity to go to waste. Because of this, we will be buying some of the surplus in order to be able to redistribute it to those who are in need. It is a win-win situation. The farmers will have a market for their products, and we will be able to help feed the people who need to be fed.
COVID-19 is a challenge like we've never dealt with before, but it certainly isn't the only test we're facing. In an increasingly complex and interconnected world, we need to think outside the box in order to keep people safe, to grow our economy, and to shape our future for the better. Artificial intelligence has the potential to be an incredibly powerful force for good, but it must be used responsibly and ethically. And on that front, Canada is continuing to lead the way forward. Today, as one of 13 founding members, Canada helped launch the Global Partnership on Artificial Intelligence. As part of this initiative, we've also worked with the government of Quebec to set up a centre of expertise in Montreal, which will be one of the partnership's 2 global hubs. This country is home to some of the world's most innovative people, not to mention the fact that Canadians have pioneered much of today's AI tech. It only makes sense to put that expertise to use. Aujourd'hui, le Canada participe au lancement du Partenariat mondial sur l'intelligence artificielle en tant que l'un des 13 membres fondateurs. Dans le cadre de cette initiative, on a également travaillé avec le gouvernement du Québec pour mettre en place à Montréal
set up in Montreal one of the 2 centers for expertise of this partnership. Canadians are prominently in the world of artificial intelligence, and therefore we will be able to put this expertise to good use.
This morning, I also joined Minister Ng and her counterparts in the Ottawa Group on World Trade Organization reform. We discussed our work together on trade, on safeguarding international supply chains, and on building a global economy that works for everyone. Now, more than ever, it is vital that we collaborate across borders to keep our economy strong and our citizens safe. This pandemic is a global crisis, and it requires global solutions. So in response to a request from the United Nations, I can also announce that Canada will provide airlift support for urgently needed medical and humanitarian supplies. Through this mission, we will be delivering help to some of the world's most vulnerable people. Ce matin, j'aimerais aussi souligner qu'aujourd'hui...
This morning, I would also like to stress that today is a World Day Against Elder Abuse. Our grandparents, our senior citizens who have built this country, we must protect them and make sure that they get everything that they need and they deserve. Whether you decide to call your grandma, your grandpa, or get news from an elderly neighbor, we all can do our work. In my riding of Papineau, we have a round table called AMI, which is there specifically to look at the question of elder abuse throughout the year and fight it. I would also like to thank and recognize all of those who work within similar organizations all over this country. Thank you for taking care of our seniors. Today and every day, we must work together to make sure that the health and the safety of all Canadians is important, whatever their age.
Built the country, and we all have a part to play in keeping them safe. On that note, let me give a big shout out to the Rogers Foundation for their $60 million donation to help the most vulnerable during this pandemic. I know this incredible initiative will have a huge impact on a whole lot of people's lives. And speaking of people who make a difference, I want to end this morning by recognizing the Canadian troops who arrived in Ukraine yesterday to resume their training mission. The work they're doing, together with our partners to build a more secure country, is incredibly important. I know all Canadians will be thinking of these brave women and men in uniform as they serve overseas. Merci beaucoup.
Merci beaucoup, Monsieur le Premier ministre. On va maintenant commencer la période de questions par le téléphone. Opérateur, c'est à vous.
Merci. Thank you. Première question, Michel Lamarche, TVA.
Michel Lamarche from TVA. Go ahead. Hello, Mr. Trudeau. Very quickly, are you ready today to commit firmly on the extension of the CERB, the CERB, for people who need it? Can you at least confirm that it will be prolonged in one form or another? Answer: I can reassure Canadians across the country, and like I said from the very beginning, we will continue to be there for those who need it. We will be giving you more details about that this week. Follow-up question? Okay, so I would like you to talk about another subject. There was demonstrations against Bill 21 for secularism in Quebec. You had you had said you would do better, and are you considering to change your mind and intervening in one way or another, and intervening about Bill 21 in Quebec because it could be considered to be part of racism and non-inclusion? Answer. My position on this has well been established and has been known for a long time. We are examining right now to see, we're looking right now at Quebecers' own reactions. The judicial system is continuing to do its work, and we will continue to be observers. Next question.
Bloomberg, line open.
Hello, Mr. Trudeau. I have a question regarding immigration targets. Do you have any sense of how the downturn will impact immigration flows over the next 2 years?
We recognize that there's been a couple of months in which very few people have come to Canada. We've closed the borders because of COVID-19, and that obviously has had an impact on the number of immigrants arriving in Canada. But Canada continues to be a country that knows that immigration is an essential source of growth, of prosperity, of opportunity, both for Canadians and for people arriving in this country. And we look forward to continuing to be a strong country in regards to immigration. We will have more to say on that, obviously, as our country begins to reopen. But at this point, we are still very much in the closed phase of the pandemic response.
Following up, Kate.
Small businesses say the rental subsidy isn't being used because landlords won't apply for it. How is your government planning to adapt this program to get more uptake and make sure that it's getting money into the pockets of small businesses that need it?
We have been impressing upon the provinces the need to move forward with eviction bans, for example. This is something we talked about a number of weeks ago when we moved forward with the commercial rent subsidy. We've seen a number of provinces move forward on it, but we know that more provinces need to step up. This is an area where the province gets to make the rules. The federal government doesn't have the levers against landlords on that, but I certainly hope more provinces will understand that an evictions ban is the right way to go. Okay. Nous avions souligné le besoin d'empêcher les evictions.
We had talked about the importance of helping the lessees not be evicted, but several of the provinces have taken up the program, and we certainly hope that all the provinces will do so.
Toronto Sun, line open.
Good morning, Prime Minister. You've been talking a lot about Canada needing to do better, Canada needing to acknowledge the past when it comes to issues around race. Your party's primary fundraising club is called the Laurier Club, and I'm wondering, given Prime Minister Laurier's history with the Chinese head tax, with blocking immigration from India, signing an order in council banning black immigration, will you change the name of the Laurier Club?
Thank you for your question, Brian. Obviously, we recognize that over the past decades and generations, Canada has not done well enough. I've apologized in the House for the Komagata Maru. We've made apologies for the head tax. We've made a direct acknowledgement of the very, very many mistakes Canada has made in the past. Those mistakes continue today with systemic racism that continues, and we need to take concrete measures to move forward, to change the systems, to improve the systems, to better support racialized Canadians and Indigenous Canadians, and that's absolutely what we're going to focus on. Obviously, there are many conversations going on around the names of sports teams, around statues, around the way we commemorate historical figures, and those conversations are going to be important and need to continue, and we encourage those conversations to be had. Okay. Je pense que le Canada doit faire mieux, évidemment.
Canada obviously needs to do better, especially when it comes to the fight against systemic racism. Obviously, many things in the past have happened. We have excused ourselves, we have apologized, but we know that we still have systems that do not treat people equally, and especially anybody who is racialized or Indigenous. And this is why we are going to work very hard to improve the situation. Now, as to this idea of looking at the names of sports teams or the names or the presence of statues and names of buildings, obviously conversations need to be had amongst us Canadians, and we will listen to the preoccupations that Canadians have.
Specifically from you, Prime Minister, how far back do you think you have to go? What is the cutoff? Is it owning slaves like James McGill, the founder and person that your alma mater is named for? Is it holding views 100, 200 years ago that are incompatible with today's views? What is it that where do you think the cutoff line is? Where do we draw the line? Where do we say this needs to be renamed, that doesn't?
I think, first of all, it's a sign of progress that things have changed so much from 100 years ago, 200 years ago, in so many ways. We have significantly improved as a society, and there is still much more to do. And I think on all these situations, it has to be discussed on a case-by-case basis. We know there will be a range of views on any given issue, and I think we need to listen carefully and with a lot of sensitivity to concerns that are brought up around what we look to renaming, what we continue, and what we use as learning lessons for future generations. Je pense que on doit.
I think that we need to approach these issues, these difficult issues, on a case-by-case basis. We need to listen to each other. And we need to be sensitive to other people's points of view and try and find the best way to go forward while acknowledging the errors of the past and understanding how far we have progressed since then. Last question on the phone.
Merci. Question, Hélène Buzetti.
Question, Hélène Buzetti from Le Devoir. Hello, Mr. Trudeau. I'd like to get back to the question of the CERB. You said that you are right now looking at prolonging it. How? Why is it so long? Can't you just put the date back a bit? We're working on it. Like I said, we will, in the next few days, give you an announcement on that issue. Not this morning, but I can reassure you, and I want to reassure all Canadians who are receiving the CERB and who are looking for a job and who are not sure they will be able to find a job between now and the end of the CERB, that we will continue to be there and help them. And we have said this from the very beginning. We are a government who is there to help the people.
People have questions about what's going to happen as they end their CERB benefits in the coming month and are worried that they're not going to be able to find another job. I will be making an announcement in the coming days on that extension and on that issue. But for now, all I can say is that we will continue to be there to support Canadians. We have said this from the very beginning, that our government will be there to support Canadians in need, and people can be reassured that we will continue to be there.
Oui, alors j'en comprends que les paramètres.
Well, so what I understand is that the parameters of the CERB are going to change itself, not just the date. Do you think that that will be enough to get the support of the NDP, since on Wednesday there is a subsidies vote, which is a confidence vote, basically? The NDP intends to vote against it. Do you think that there is a risk that your minority government fall and Canada finds itself once again facing an electoral situation? Well, in a minority situation, obviously parliamentarians will decide what's going to happen. We will continue to help all Canadians. We will continue to be present for families and workers who need it. And I think that this is what all of the members of Parliament expect. Philippe Vincent, Radio-Canada. My colleagues in New Brunswick, we know that two Indigenous people were killed by police, Chantal Moore and Mr. Philly. So do you believe that there is a need to have a public inquiry to understand what happened? These families certainly deserve answers, and we are there in our hearts and souls. Obviously, there's a lot of questions. We need answers, and we expect an an inquiry on what happened, and the families need to have answers.
First of all, my heart goes out to the families of and loved ones of those who died. It is really important that they get answers, that we all get answers on what happens, and that's why we need open and transparent investigations to provide answers to Canadians on individual cases. But we also need to pay attention to the larger systemic challenges that these are illustrative of.
C'est public, ça, une enquête ouverte et transparente? C'est la question qui était...
When you say inquiry, do you mean public? Well, I think, yes, it should be public, absolutely. On the question of racism, you didn't answer directly the question that was asked to you about the Laurier Club. Do you think you said that there's a systemic racism in all Canadian institutions, but you're not proposing an awful lot of solutions. You're just saying it. It's nice to give lessons, but you have to give solutions as well, Mr. Trudeau. Where are your solutions? Answer. We have been working for the last few days to deepen our exchanges and our work with Indigenous communities and racialized communities. We know that many proposals have been made throughout the last while, and proposals that have been made, we want to work with committees and prioritize what we're going to be working on, and then we'll have a lot more to say about this shortly.
Over the past years and decades, received many stacks of recommendations, of analyses, of reports on measures that can be taken to better fight against systemic racism, to reduce inequities in our system against racialized Canadians and Indigenous Canadians in particular. It is a question of picking which of those recommendations we should be moving forward with first, and that's why we're working with Indigenous leadership and communities, working with the Black community, working with racialized Canadians to prioritize exactly what things we should do rapidly, right away. We'll have more to say in the coming days on that.
Marie Gauche with the Globe and Mail. Prime Minister, the shooting death on Friday is the latest of 6 since April. 6 Indigenous people have been shot and killed by police in Canada. 2 other Indigenous people have died in the company or in the custody of police, but the circumstances of their deaths are unknown. That's just in the last 3 months. What specifically will your government do to ensure this doesn't continue?
There is systemic racism in Canada, and it means that Indigenous people, Black Canadians and racialized Canadians are far more likely to suffer violence at the hands of the authorities and police than non-racialized Canadians. This is a problem that we have seen for many years. We have made steps to improve it, but there is a need for much more, much quicker. And that's why we are working right now with communities to address the first things that need to be done most rapidly, and we are going to move forward with them rapidly. Nous reconnaissons que depuis longtemps.
We have known that for a long time now, the system has treated racialized Black and Indigenous Canadians differently than Canadians who are not in those minorities. So we have taken steps over the last few years to try and improve the situation, but obviously there's a lot more to do, and we will do so. Right now we are working with experts within the communities and of the different groups concerned to identify what measures should be undertaken first and quickly, and we will be making some announcements over the next few days.
Had these reports and these recommendations, and you have been in government for 5 years, and the action has not been taken. One of the very specific recommendations from Murray Sinclair is that police be screened for their attitudes on race. Do you support that, and will that be implemented?
We have, over the past years, including under Commissioner Lucky, transformed a number of the protocols around hiring at the RCMP, although other police forces are jurisdictions of other orders of government, and we will commit to doing more. We know there are many, many different things that need to happen in order to go after and to reduce systemic racism, and we will work with communities to prioritize which ones we should do first and most rapidly.
So will you accept it?
Okay. Nous reconnaissons qu'il y a énormément à faire dans les jours à
So we recognize there's a tremendous amount of work to do in the coming years. We have taken tangible steps over the last few years, but there is more to do, and we will be working with the RCMP. And we hope that all the different levels of government will be working with their police forces to improve recruitment and the different procedures.
On the CERB extension possibility, obviously there's an issue here in terms of the numbers of people on the CERB as opposed to companies with the wage subsidy, very low uptake on the wage subsidy. So with this extension and provinces reopening, what more can your government do to encourage companies to use the wage subsidy aside from just begging and pleading?
Every week we see more and more companies take on the wage subsidy as their economies, as our local economies reopen. We have millions of Canadians receiving the wage subsidy, and we're seeing as people get back to work, as jobs get created, people are taking it up. The CERB was designed to keep everyone at home and allow us to get through the initial wave of this pandemic. Now, as we move into the recovery phase, we're seeing more and more companies take on the wage subsidy, which is a good thing. But even with economy reopening, we know there are many jobs that aren't going to be coming back in the short term, and that's why we are looking at continuing to help people who are on the CERB who can't find a job. There
are millions of Canadians who benefit from the wage subsidy. With the reopening of the economy, more and more jobs can be created and people are leaving the CERB to get work and get the wage subsidy that helps them with their wages. We still have work to do because even with the reopening, there are many jobs that have disappeared and will not be back in the short term, and so we'll be there to continue helping those who cannot find work and who still need the CERB.
Dramatic spike in coronavirus cases in a fair number of U.S. states. New York's governor, this is governor, they're musing about possibly going into lockdown mode again. What specific concerns are there for your government in that when you think of obviously the border restrictions and the talks to keep that ongoing? How concerning is that?
On Thursday night with the premiers, we had another good conversation around the border restrictions, particularly with the United States. And it is clear that there is broad consensus across the provinces that we need to continue to keep our current border measures in place. We will keep discussing with the United States administration on ways forward. But our priority on this is to ensure that we're keeping Canadians safe while continuing to ensure the flow of essential goods and services.
Last Thursday, with the premiers, we discussed the question of the borders. And there is a clear consensus amongst everyone that the premiers of the provinces want us to continue with the current measures at the border with the states. We are currently discussing this with the American administration so that we can continue ensuring Canadian safety.
News, Prime Minister. Last week there were reports that your immigration minister presented a plan to give permanent residency status to asylum seekers who are working in the healthcare industry here in Canada. What will the eligibility criteria be, and also will that be extended to essential workers, not just healthcare workers?
Obviously, Canada is a country that has a strong immigration system, and part of the strength of that immigration system is that it is a rigorous application of immigration rules that reassures Canadians that we can continue to be positive towards immigration, even as people around the world turn away from immigration. At the same time, we recognize the extraordinary work done by many vulnerable people to care for other vulnerable people, including asylum seekers. And we are, of course, looking at ways to recognize the invaluable support that they've given to Canadians at a very difficult time. Okay. je pense qu'un des principes qui rassure.
I think that one of the principles that reassures Canadians on immigration is that we have a rigorous principle where the rules are applied systematically throughout the country. At the same time, we recognize that we are in a situation where some very vulnerable people, such as asylum seekers, got involved to help our seniors, to help other vulnerable people. And we are looking into ways to support them.
Just come back to the Canada-U.S. border. Despite everybody's consensus to keep it sort of as tight as it is now, we're seeing some loopholes. We're seeing American tourists transit to Alaska from the lower 48, stop in at Banff for a day or two. We've heard of stories of people denied the ability to, non-essential people coming across a land border who have then flown across the border. Is this acceptable? What's your government thinking about that?
Obviously, we've heard those reports over the past few days and are looking into them. I think as we continue our conversations with the Americans, as we look at adjusting or shifting our posture in certain ways, we need to make sure that we're able to apply the rules consistently and that we're doing everything necessary to keep Canadians safe at this important time. Évidemment, j'ai entendu ces rapports.
I, of course, heard those reports, and we're looking into what we can do while we are negotiating with the Americans on the potential extension of these border restrictions. We will make sure that we will prioritize, as always, the safety of Canadians.
Merci tout le monde.
Thank you, everyone.
All right, Andrew Thompson.
Good morning, everyone. Thank you for being with us this afternoon. I have the pleasure of being in the company of Dr. Tam, who is Canada's Chief Public Health Officer, and Dr. Nou, qui est l'administrateur en chef de la santé publique du Canada.
Chief Public Health
Alors,
Officer
Dr. Tam,
Canada.
à vous la parole.
Dr. Tam, the floor is yours.
Good afternoon. Bon après-midi à tous. I'll start with the latest numbers on COVID-19 in Canada. There are now 98,787 cases, including 8,146 deaths, and 60,272, or 61%, have now recovered. Labs across Canada have tested over 2,152,000 people for COVID-19 to date. And over the past week, we've been testing an average of 33,000 people daily with 2% positive. Again, these numbers can change very quickly and are updated on canada.ca/coronavirus. Today, I just want to really remind Canadians that the reality is that COVID-19 is still out there and it will be with us for the foreseeable future. So as we get out more, I mean, I saw people going out on the weekends from our home and into public spaces. It's even more important to keep up with our now learned public health measures, including physical distancing and good hygienic practices, such as frequent hand washing and cough etiquette. For areas where COVID-19 is still active, it's recommended that you wear a non-medical mask or face covering when you can't keep that 2-meter distance from others. This is really important, and I've heard from my colleagues that younger people are going outside and may not be respecting some of these public health advice, so please listen to your local health unit. And even if you feel you're young and somewhat invincible, that is not the case. Young people have got sick, been hospitalized with COVID-19, and you can spread this virus to others. This virus is a bit hidden. It can transmit in a sort of stealth-like fashion in hidden chains of transmission, and you can then impact people who are more vulnerable as well. So that's just a really important reminder. So people across Canada have worked hard to slow the spread of COVID-19 by staying home and doing all these measures. However, home is not a safe place for many people experiencing family violence. Family and gender-based violence includes child maltreatment, intimate partner violence, and elder abuse and neglect. It it has devastating consequences for children, women, families, and communities, and has long-lasting impacts on physical and mental health, and can affect future relationships and future generations. Today, June the 15th, marks World Elder Abuse Awareness Day. In 2018, more than 12,000 adults aged 65 or older in Canada reported violence to the authorities. And in about a third of these cases, the abuse was committed by a family member. There are concerns about an increase in family and gender-based violence in the time of COVID-19. Some jurisdictions have observed increases in reports of domestic violence, calls to crisis support lines, and demand for emergency shelter, while child welfare organizations have observed a concerning decrease in the reporting of child abuse and neglect. Public health measures necessary to slow the spread of COVID-19 are leaving some Canadians isolated with violent partners or family members. During the pandemic, typical community supports have not always been available to identify and support those at risk, including seniors. Asking for help can be hard, but I want Canadians to know that there are services available to help. If you are a woman experiencing violence, sheltersafe.ca can connect you with a shelter in your area. If you are a young person at risk or experiencing violence, you can call Kids Help Phone for confidential help and support. If you are in immediate danger, call 911 or your local police. If you are a healthcare or social service provider, you may be one of the first points of contact for a person experiencing family violence. It is important that you are equipped to recognize signs of family violence and to respond safely and effectively. The Public Health Agency of Canada has supported the development of evidence-based guidance and online education resources to help you recognize and safely respond to child maltreatment, intimate partner violence, and children's exposure to intimate partner violence. The VIGA, Family Violence Education Resources, are free and publicly available on the McMaster University website. And these are available in a bilingual format. Family violence and gender-based violence are serious public health issues that affect children, youth, families, women, and communities. Remember that while many of us are at home due to COVID-19, not every home is safe. If you're experiencing family violence, know that help is available anytime, day or night. You're not alone in this. Thank you.
Thank you, Dr. Tam. Dr. Nu, s'il vous plaît.
OK, merci. Bonjour. Je vais commencer par vous donner les derniers chiffres sur la COVID-19 au Canada. Il y a maintenant 98 787 cas, dont 8 146 décès et 60 272 personnes rétablies, soit 61% des cas. À ce jour, les laboratoires de partout au Canada ont analysé les tests de dépistage pour la COVID-19 de plus de 2 152 000 personnes. Au cours de la dernière semaine, nous avons testé en moyenne 33 000 personnes chaque jour, dont 2 ont obtenu des résultats positifs. Ces chiffres évoluent rapidement et sont régulièrement mis à jour sur le site canada.ca/le-coronavirus. Aujourd'hui, on veut aussi rappeler aux Canadiens qu'en réalité, la COVID-19 est toujours présente et elle le sera dans un avenir prévisible. Comme nous sortons plus de chez soi et dans des endroits publics, il est encore plus important de garder la distanciation physique et les bonnes pratiques d'hygiène, telles que se laver les mains fréquemment et respecter l'étiquette relative à la toux. Dans les régions où la COVID-19 est toujours active, il est recommandé de porter un masque non médical ou un couvre-visage lorsque vous ne pouvez pas garder 2 mètres de distance des autres. Partout au Canada, les gens ont travaillé fort pour ralentir la propagation de la COVID-19 en restant à la maison. Toutefois, pour beaucoup de personnes qui subissent de la violence familiale, la maison n'est pas un endroit sécuritaire. La violence familiale et la violence fondée sur le sexe comprennent la maltraitance des enfants, la violence conjugale, la maltraitance et la négligence des personnes âgées. Les conséquences sur les enfants, les femmes, les familles et les communautés sont dévastatrices. Cette violence a des conséquences de longue durée sur la santé physique et mentale et elle peut nuire aux relations futures et aux générations futures. Aujourd'hui, le 15 juin, est la Journée mondiale de la sensibilisation à la maltraitance des personnes âgées. En 2018, plus de 12 000 Canadiens de 65 ans et plus ont fait une dénonciation aux autorités pour cause de violence. Sur environ un tiers de ces cas, les mauvais traitements avaient été commis par un membre de la famille. En cette période de pandémie de COVID-19, certains s'inquiètent d'une augmentation de la violence familiale et de la violence fondée sur le sexe. Certaines administrations ont observé une hausse de signalements de violence familiale, des appels aux lignes de soutien et en cas de crise et des demandes d'hébergement d'urgence, tandis que les organismes d'aide à l'enfance ont observé une baisse inquiétante des signalements de maltraitance et de négligence envers les enfants. Les mesures de santé publique nécessaires pour ralentir la propagation de la COVID-19 laissent certains Canadiens isolés avec des partenaires ou des membres de la famille violents. Durant la pandémie, les ressources communautaires habituellement disponibles pour identifier et soutenir les personnes à risque, dont les personnes âgées, n'ont pas toujours été en mesure d'offrir leurs services. Il peut être difficile de demander de l'aide, mais on veut que les Canadiens sachent qu'il y a des services qui peuvent les aider. Si vous êtes une femme qui vivait avec la violence, hébergement femme.ca peut vous mettre en contact avec une maison d'hébergement de votre région. Si vous êtes une jeune personne à risque de subir de la violence ou qui subissait de la violence, vous pouvez appeler Jeunesse, j'écoute pour de l'aide et du soutien confidentiel. Si vous êtes en danger immédiat, appelez le 911 ou votre service de police local. Si vous êtes un travailleur de la santé ou des services sociaux, il se peut que vous soyez un des premiers points de contact pour une personne qui vit de la violence familiale. Il est important que vous soyez outillés pour reconnaître les signes de violence familiale et pour intervenir rapidement et de manière sécuritaire. L'Agence de la santé publique du Canada a appuyé l'élaboration d'un guide basé des données probantes et des ressources éducatives en ligne pour vous aider à reconnaître la maltraitance envers les enfants, la violence conjugale et l'exposition des enfants à la violence conjugale, ainsi qu'à y répondre en toute sécurité. Les ressources éducatives sur la violence familiale VEGA sont gratuites et accessibles au public sur le site web de l'Université McMaster. La violence familiale et la violence fondée sur le sexe sont des graves problèmes de santé publique qui ont des incidences sur les enfants, les jeunes, les femmes, les familles et les communautés. Rappelez-vous que même si beaucoup d'entre nous sommes à la maison en raison de la COVID-19, ce ne sont pas tous les milieux familiaux qui sont sécuritaires. Si vous vivez de la violence familiale, sachez que de l'aide est disponible en tout temps, jour et nuit. Vous n'êtes pas seul. Merci.
Thank you, Dr. New. Before we turn to questions, I would like to briefly summarize some of the announcements made by the Prime Minister this morning. First, on the Canada Emergency Business Account, the latest number indicates that a total of 670,000 small businesses have received a small business loan in the last few weeks. The Prime Minister announced today that on Friday an application website will be provided to extend the eligibility for those small businesses loans. They will in particular allow small businesses that pay dividends to sole owners or that work with contractors or that operate in a manner which made them initially ineligible to the CERB. Those small businesses will be able to apply starting on Friday. La deuxième annonce rapide
sur l'intelligence artificielle, la création d'un centre d'expertise international et d'un partenariat mondial sur l'intelligence artificielle en partenariat avec 14 autres pays, en appui aussi avec l'OCDE. Tout ça centré sur l'humain. On sait à quel point l'intelligence artificielle est capable de nous amener plus loin en termes d'humanité. en termes de développement durable, en termes aussi de développement économique, d'augmentation de la productivité, mais aussi en matière de protection de l'environnement et de la santé. Et on sait ce que ça veut dire, la protection de la santé dans le contexte actuel de la pandémie. Donc, les techniques qui vont continuer à être développées et appuyées, entre autres par la création de ce partenariat et de centres d'expertise, vont nous permettre d'aller plus loin et plus rapidement dans le contexte de la COVID-19, mais aussi dans le contexte futur d'autres pandémies.
And finally, an important announcement as well on the $50 million surplus food rescue program. Today is the starting date for the application to that program. That program is designed to support food producers and food transformers, as well as to support vulnerable Canadians, and as well as to reduce food waste. So again, the application for that important program is being launched today. Nous serions maintenant très heureux de répondre à vos questions.
Merci, Monsieur le Ministre. As usual, we'll start with 3 questions on the phone, 1 question, 1 follow-up, and then we'll turn to the room. Operator, over to you.
Thank you. Merci. Our first question, notre première question, is from Hélène Bivetti avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour. Ma question est pour le ministre Duclos. C'est concernant le prolongement de la PCU. Le premier ministre nous a indiqué, oui, que ça s'en venait, mais je ne comprends pas qu'est-ce qui est si long si ce n'est pas seulement que de prolonger la date. Doit-on comprendre que les paramètres du programme vont changer aussi?
Bien, ce qui a changé, et ça c'est en lien avec votre question, c'est les circonstances économiques des dernières semaines. La PCU, comme on le sait, était conçue au départ pour geler l'économie, pour permettre aux gens de protéger leur santé et la santé de leurs proches. Mais dans la situation sanitaire et économique a changé au cours des dernières semaines et effectivement, comme vous l'avez dit, les discussions importantes que nous avons et l'annonce importante qui va venir prochainement focalisent sur l'ajustement des paramètres et possiblement de la durée, vous le verrez bien dans quelques jours, de la PCU pour faire en sorte que la PCU s'adapte davantage au contexte actuel à la fois sanitaire et économique.
Oui, dans le passé, pour instaurer le programme, il a fallu adopter un projet de loi. Donc, j'aimerais vous entendre, faudra-t-il passer par la Chambre des communes pour modifier de la manière que vous dites la PCU? Et dans le contexte où le Parlement cesse de siéger cette semaine, aura-t-on le temps de faire ça au cours suffisamment vite, en tout cas, pour que les gens puissent en profiter sans qu'il y ait d'interruption de prestations?
C'est effectivement une très bonne question. Ceci étant dit, on va malheureusement devoir être un peu patient parce que l'annonce n'ayant pas été faite encore, les détails sur les travaux législatifs possibles qui pourraient être nécessaires vont devoir être fournis un peu plus tard.
Merci, Monsieur le Ministre. Opératrice, prochaine question, s'il vous plaît.
Thank you, Mr. Minister. Next question, please.
Thank you. Merci. Our next question, prochaine question, is from Sharon Kirky with the National Post. Please go ahead. À vous la parole.
Well, hi, thanks for taking my question. Dr. Tam, Prime Minister Boris Johnson over the weekend talked about a review that he's commissioned of the 2-meter physical distancing sort of edict, and Quebec today said that it's reducing its physical distancing requirements for children 16 and under, and it's also going to reduce it to 1.5 meters in places that people don't frequently talk to each other, like movie theaters. And Canada is one of only a few countries that recommend a 2-meter physical distancing space at the federal level. Could you tell me what that Canadian guidance is based on, and are you looking at whether that can be relaxed somewhat?
I think, as everybody knows, we're still learning about this virus, and we absolutely should be reviewing evidence as we're going along and adjusting guidance accordingly. What we do know is the virus is primarily spread by people who are close to each other, coughing, sneezing, even speaking, shouting, even talking. And the larger respiratory droplets, for example, will fall and closer and quicker to the ground. We know that if you maintain a distance of 1 meter, you can avoid some of these droplets, perhaps the majority of them. But 2 meters distance means that you can avoid some more of these droplets, perhaps landing on you. So I think it's a matter of a gradation of risk as well. At the same time, of course, we've advocated for other measures that can be layered on top of the physical distancing measures, including, for example, the wearing of masks if people can't keep the 2-meter distance. So because it's a multifaceted approach, people have to sort of evaluate the environment, the context, who is in that environment, and do a proper risk assessment. But the bottom line is that, 1 meter can help avoid some of those droplets. 2 meters will be a bit better. And so some of it is maybe about feasibility in certain settings. So I think it's a matter of a risk assessment approach, which we've been advocating. But we will continue to learn and see what actually happens should people reduce these measures, but absolutely maintain all the other measures as well. You've got to do that. So I look forward to ongoing sharing of best practices as well as evidence with the other chief medical officers.
Follow-up?
Thanks. My other follow-up, and you talked, Dr. Tam, about those other measures like wearing of masks. And a group of Ontario doctors is really urging the federal and provincial governments to mandate mask wearing in an attempt to slow the spread of SARS-CoV-2. And why have you not mandated mask wearing in public indoor spaces like grocery stores?
So again, in a discussion with other chief medical officers, they emphasize that people have to listen to local public health and know what the virus activity is in the community. Some communities haven't experienced community transmission. Others clearly have and continues to experience virus transmission, even as cases come down. So they would like to exercise that flexibility according to evidence and data in their particular community. And so at the national level, we agreed to recommend the use of non-medical masks in the context of communities where the virus is still circulating or have recently circulated in areas where you can't keep that physical distance, particularly indoor enclosed spaces, grocery stores, public transport. And so that is a matter that is being determined at the local level.
Thank you, Dr. Tam. Operator, we'll take one last question on the phone before we turn to the room.
Thank you. Merci. Our next question, notre prochaine question is from Michel Lamarche avec TVA Nouvelle. Please go ahead. À vous la parole.
Oui, bonjour. C'est une question pour le ministre Duclos. Monsieur Duclos, pouvez-vous, on comprend là, pour la PCU que ça s'en vient plus tard cette semaine, l'annonce, mais pourquoi vous ne pouvez pas juste nous dire, pour rassurer les gens, vraiment les rassurer que ça sera prolongé sous une forme ou une autre pour ceux qui demeurent dans le besoin?
Merci, Michel. Et on comprend très bien qu'il y a beaucoup non seulement d'interrogations, mais aussi beaucoup d'anxiété autour de la PCU. La PCU a eu un impact extraordinairement important, à la fois au point de vue économique et social au cours des dernières semaines. N'eût été de la PCU, nous serions dans une situation économique beaucoup plus grave et nous serions probablement dans une situation de crise sociale majeure. Alors, on comprend donc à quel point les interrogations et les inquiétudes sont importantes. M. Trudeau, ce matin, a rappelé qu'on va toujours être là pour prendre soin des gens, en particulier ceux qui se retrouvent dans une situation de vulnérabilité importante présentement et qu'il y aura prochainement une annonce à cet égard.
Michel, en suivi.
Follow-up question, Michel.
M. Duclos, vous ne pouvez même pas nous dire aujourd'hui que vous allez la prolonger, la PCU. Là, tout le monde attend après ça. Je veux dire, l'annonce en vient cette semaine. À quoi ça rime tout ça? Pouvez-vous juste nous dire que ça sera prolongé, même si vous n'avez pas de durée dans le temps à confirmer aujourd'hui?
Je pense que vous pouvez un peu lire entre les lignes, dans le sens que quand M. Trudeau a dit qu'on allait être là pour les Canadiens, c'est qu'il va y avoir autre chose qui va être annoncé prochainement. On veut faire quand même les choses correctement. Alors, c'est pas juste une question de prolonger ou de changer ou d'ajuster. Les gens veulent savoir exactement qu'est-ce qui s'en vient. Et c'est pour ça qu'on a encore besoin de quelques heures, de quelques jours à la limite, pour que les Canadiens comprennent encore mieux ce que M. Trudeau a dit ce matin lorsqu'il a dit qu'on allait être là pour prendre soin de tout le monde, y compris les gens là, qui vivent une situation économique difficile.
Merci, Monsieur le Ministre. We will now turn to the room, starting with Mr. Lundgren from Reuters.
Yeah, a couple of questions for Dr. Tam. We're about to hit 100,000 cases. Canada is 12th on the list in the world for number of deaths, 17th on the list for number of deaths per 1 million population, which suggests that things haven't gone brilliantly. So, first question, if you had to give a report card to all the efforts done in this country so far to tackle this, what would your report card be?
So I think as we come down the sort of side of this first wave, it is good time to take stock of lessons learned and how we've done. I think Canadians have done an amazing job in all of their efforts to practice physical distancing, staying at home when they were asked to do so, and trying to learn all of these new hygienic measures and keep up with it. So we need to have a sustained path forward so that these become actual everyday practice, so that that can be sustained, because we know that this we have learned more about how this virus is spread. I think that in Canada, of course, one of the biggest lessons learned is about who is most severely affected in the vulnerable populations. And in particular, I think our first wave of epidemic really impacted seniors and those who live in seniors' residences or long-term care facilities. So that's got to be the biggest lessons learned for Canada, and where much has begun, but more needs to be done to ensure that that doesn't occur, and that best practices in place, infection control, but also the conditions of living and congregate living, and how we treat our seniors in general in society. And that is a responsibility for governments, but also for all those who manage long-term care homes, and also society writ large. The other aspect of, I think, where spread has occurred more rapidly and accelerated in other vulnerable settings. So we've got to learn from those work settings, for example, which include more crowded spaces, but congregate living spaces for workers, workers who are not paid well enough and they have to transfer between facilities. All of those things is what has, I think, driven some of the bigger clusters and outbreaks in Canada. And we need to have learned from them, and so that as we move forwards, that the surges in cases doesn't happen again, because we've learned all of those things, which I think some of the other countries have learned as well. So particularly some of the other European countries who may have some similar setup in terms of their elder care, and also some of these workplace phenomena. So I think what we have done is, with everybody's help, flatten to the curve to the extent that we did not overwhelm our acute care system, but we certainly did not do well in the sort of long-term care senior setting.
And secondly, looking to challenges ahead, you mentioned concern that some young people are being complacent about mask wearing. I'm thinking of what you've mentioned about old care homes, horrifying spike in cases in some US states. Looking ahead, what are the main challenges to you as you and your colleagues continue trying to handle this, and how do you quantify the seriousness? Are these hiccups that can be dealt with fairly easily, or is there the potential for one or more of these challenges to really knock you off course?
So we continue to learn about this virus, and I think the fact that we've learned about how this virus could spread in a hidden way, people with very mild symptoms or sometimes no symptoms at all, which could be the case in younger populations, is that people will forget as the number of cases come down, and which is great, but I think it's the sustainability of our response going forward that is going to be really tough. So we will just have to keep reminding people maybe use behavioral science and visual cues as to, well, how do you keep that physical distancing? You've seen in parks where people draw circles or people have lines on the ground to remind people how to keep physical distancing, because it's not easy to sustain that kind of approach in people's minds. But it's really, really important because the virus hasn't disappeared. We have probably low immunity in the population. We are still going to be doing those serological testing to see what the prevalence is in the population. But the virus has not gone away. There's a misconception, I think I got asked the question last week, which was, well, has the virus changed? Is it less severe or less transmissible? Well, no. The cases are coming down because of the public health measures that we've done, not because the virus itself has changed. It's the number of cases reduced because of all of those things that we have put in place. So I think together with the chief medical officers, we're trying to think, well, what are the sustainable measures that we can keep going, while at the same time, the key is to build up enough public health capacity and healthcare capacity to essentially clamp down, detect and clamp down on any cases and contacts. So some of our collective readiness measures to reduce resurgence is related, as everybody has heard, increasing laboratory testing capacity, increasing contact tracing abilities, and making sure people have a safe and appropriate place to quarantine and isolate. And so you will see those measures continually to be built up, and we are certainly, one of the scenarios we're preparing for is a potential surge in cases come the sort of fall and winter season, and plan that ahead, and also plan for a scenario, for example, where influenza might be circulating at the same time. So I think what we're asking all Canadians to remind themselves is it's not normal times. We're not going back to before January 2020, and that everyone, including young persons, must follow local public health advice.
Thank you, Dr. Tam. Mr. Aiken.
Thanks. Hi, David Aiken, Global News. Minister Duclos, question for you, a couple of them about our access to information system. So this morning I filed a routine request to a federal department. I asked for a briefing note, 10, 20 pages long, identified by the departmental tracking number. And here's the typical response I just got. We are requesting your consent to place your request on hold temporarily. It's a very common response. What would you say?
Well, I would say two things, or three things. First one is I understand what you say, and I can also feel how frustrating it must be for you and for many other journalists to get that type of answers, because you have a very important role to play, and for that role to be played, you need all the input that you need. The second thing is we understand also that for the public service, that the times are challenging. Many of them are living in an environment where it's more difficult, given current technology, to have access to the information that they need to support your work. And that's in large part because, as I said, because of technology. The technology that is still being used now in the Government of Canada is a technology that makes it difficult, even in normal circumstances, to respond appropriately and quickly to the type of requests that you make. The third thing that I would say is that we will be entering very soon into a review process around the access to information law and the associated changes that we'll need to put into place. I've already discussed with the Information Commissioner a couple of important things that she has on her mind, and we look forward to working with her and with many others to improve the quality of the services that you receive.
Thank you. Noting how common the phrasing is, the response is across all government departments, particularly the major ones handling access to information requests, and given that every department looks to Treasury Board for guidelines on processing ATIP, it seems impossible not to conclude that there was a memo coming from you or your deputy to ATIP functions across departments, forgiving them of their obligations under the Access to Information Act so far as timeline goes. I wonder if you can talk about that, and also talk about what instructions do you have for them now to clear the backlog, to get these workers in our government back to work, just as we are in broader society, to fulfill, again, the obligations under a law.
Yeah, well, there are two things in your line of questioning. The first one is about a memo, and there was indeed a guideline sent by the Treasury Board and myself in particular to public servants just a few weeks ago, reminding them of the information to do the important job that
they need to do to support your work. And despite the emergency circumstances, that job must continue. And the second line of questioning is around the fact that there might be a view that we are not taking this as seriously as we should. I think this, although I understand again the frustration that you would feel, I can assure you that Treasury Board has made clear, and public servants everywhere, I think, have clearly understood that they need to continue that important job. We hope that despite the possible length of the pandemics, it will become easier and better to get that information. And as I said, there was a longer-term agenda to improve both the technology and, to be frank, the attitudes of governments in that particular area.
Thank you, Minister. Olivia.
Good afternoon. My questions are for Minister Duclos. I understand, of course, your government says today that it's looking at ways to extend CERB, but I'm looking for details about how you're working on a plan to transition millions of people off this program. How exactly will your government decide when CERB can end?
Well, transitioning is the key and the right word. Initially, transition was not in our minds. It was important, as I said in French earlier, to make sure that people had the ability to stay home and still to put food on the table. But there comes a time, and the time has now arrived, where we do indeed must think about transitioning, because some sectors of our economy have already started to transition, and the CERB, like other social support programs, must be there to support both workers and job creation. So the overall environment, I would say, is a changing one. It's a rapidly changing one, where we must indeed take into account the social impact of CERB, very significant. There would be a significant, severe social crisis now if CERB had not existed. The economic crisis, which CERB is indeed helping to reduce, and taking into account the technological challenges. You know that had we relied on the EI, the employment insurance system, in April, it would have taken almost 2 years for the 8 million Canadians to be given support. So that obviously wasn't wasn't possible at that time. So while we envision transitioning, and we'll be, as I said, announcing important things around that in the next few days. The Prime Minister said that this morning. There will be, of course, connected to that announcements as to how we will make sure that the technology supports that transition.
Is your government considering any specific options that would remove powers and defund police?
Well, this is, of course, part of a very broad and important discussion that we must all have, including the police force. And I think, again, the Prime Minister has made quite clear his views on that just last week. What he also said, and what I could perhaps remind everyone of, is that there are other ways of, in addition to making sure that police forces have both the right signals, the right expectations, the right obligations, and the right tools to work with and on. There are also many important measures that the federal government can use, and I would signal that one of them is through the public service. The public service has diversified over the years, but I've looked at the recent numbers, and we need and we can do a lot better. So with the clerk and with my colleagues around cabinet, we'll be looking carefully both at the numbers and what we want the situation to be in the relatively short term.
Thank you, Minister. We'll just go back to the phone before we turn to you, Kevin. So, operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question. Avec Agence QMI, please go ahead. À vous la parole.
Bonjour, ma question pour M. Duclos. Donc, si je comprends bien, aujourd'hui, on a une annonce pour dire qu'il y aura une annonce dans quelques jours. Pour les personnes qui sont à la maison et qui vivent dans l'anxiété, vous avez dit qu'on reconnaît l'anxiété et qui ont de la misère à comprendre, et vous répondez ensuite qu'il faut lire entre les lignes. Comment ces personnes peuvent être rassurées aujourd'hui?
Le mot rassurer est le mot important, et M. Trudeau, ce matin, a rassuré tout le monde. Il a bien dit que nous allons être là pour aider tout le monde. Il n'a pas dit exactement comment, mais ça s'en vient rapidement. Mais je pense que les dernières semaines et certainement les actions que nous avons vues au cours des dernières semaines ont clairement indiqué aux Canadiens à travers le pays que nous avons été là rapidement et efficacement et que M. Trudeau annonce encore ce matin que nous allons continuer d'être là.
And Mr. Trudeau said this morning that we will continue to help people. Follow-up question, Émilie?
Oui, en suivi, donc mercredi, il va y avoir l'étude des crédits supplémentaires. Comme président du Conseil du Trésor, c'est évidemment un nouveau dossier. Le budget pour la PCU a déjà été revu à la hausse dans les subsides qui vont être débattus pendant 4 heures. Qu'est-ce que l'éventuelle prolongation, dont vous ne voulez pas nous donner les détails, va venir faire là-dedans? Qu'il y aura besoin d'avoir une hausse encore du budget de la PCU au-delà de ce qui est dans les subsides.
Bien, vous avez effectivement fait allusion au fait que je devais être au courant de ce qu'on appelle des budgets de dépenses, des supplementary estimates en anglais. Effectivement, c'est mon travail d'être au courant et de suivre ça de tout près. Bon, je vais éviter d'être trop technique, mais ce qui va être déposé mercredi a 2 composantes. Une composante qu'on appelle statutaire et une composante qui est une composante votée. La composante statutaire, c'est la grosse composante de ce qui s'en vient mercredi. Ça, c'est une composante qui a déjà été adoptée par la Chambre des communes lorsque la Chambre des communes a mis en place la prestation canadienne d'urgence. Donc ça ne crée pas d'incertitude pour mercredi parce que cette capacité du gouvernement fédéral de financer la PCU et ce qui va suivre par la suite, elle est déjà captée par la partie statutaire. Mais il va y avoir effectivement mercredi une discussion importante autour d'autres items qui, eux, n'ont pas encore été approuvés par la Chambre des communes.
Merci, M. le ministre. Opératrice, prochaine question.
Next question, please, operator.
Thank you. Merci. Our next question, notre prochaine question is from Jim Bronsko with the Canadian Press. Please go ahead. À vous la parole.
Good morning, Mr. Duclos. You hinted a moment ago that one of the things you're looking at is increasing the diversity of the public service. The Prime Minister spoke this morning in the same vein about things that could be done in the relatively short order, that he was consulting with communities. The government is looking at things it can do relatively soon in fighting systemic racism and making changes. What are some other examples of what the government is looking at?
Well, if I may come back quickly to your first point on diversity in the public service. The first deputy minister, the first black deputy minister, was nominated just a few months ago. The first black chief of staff of all governments at the federal level was nominated by myself just a few months ago. And it's both in both cases, these are women, black women. I think they demonstrate that with many others around the public service that we can do better. Now, these are both important but still modest achievements. So we have a lot more to do. At the public service level, it's particularly among the higher level public servants that the lack of diversity is more present, and where the absence of black public servants is noticeable. Outside of the direct public service, I may also add that we have made some important progress in the last 4 or 5 years. For instance, the percentage of nominations of black Canadians, nominations made by the federal government, has doubled from about 4 to about 8% in the last 4 years. So this is good. It's not enough yet, but we will be working obviously very hard to improve that. Now, more broadly, what the federal government can and should do is to help others remove barriers, because it's all about barriers. It's barriers that are either seen by others or not seen by others. And for these barriers to be seen by others, I would use the image and the sentence of the Prime Minister when he says that it's sometimes difficult for people like me in particular to understand and see and feel the barriers felt by others, because I'm
relatively privileged person. I haven't suffered from discrimination. So it's all about empowering everyone, not only Black Canadians, empowering everyone to see the barriers that others are facing. And as elected officials and as more generally as citizens, we do have both the ability and the responsibility to help.
Jim, follow up.
Minister, just thank you for that. Just can you provide us with some examples of what you can do to help remove those barriers you just spoke of?
Well, you mentioned very briefly, you heard about public safety, education, to make sure that, as I mentioned earlier, the public service is barrier-free. My colleagues with Indigenous Canadians, obviously, my colleague, Minister Chagger, around diversity and inclusion, because in Canada we're very proud of our diversity. It's our source of strength and pride, but with diversity needs to come inclusion. There's so many other fields, some of them in the domain of provincial jurisdiction, in which the federal government can have either a direct or an indirect influence. And to be honest, the Prime Minister has already engaged all of us in the last 2 weeks, has asked all of us to work very quickly and very efficiently in coming up with a way forward.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question is from Lina Dib with la Presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour. Ma question est pour vous, Monsieur Duclos. C'est encore au sujet de la PCU. Ça fait des semaines, des mois qu'on constate que la subvention salariale, ça n'a pas autant de preneurs qu'on voudrait que ça en ait au gouvernement. Et là, en annonçant la prolongation de la PCU, est-ce que vous n'êtes pas encore une fois en train de nuire à la subvention salariale en laissant les gens plutôt chez eux à ne pas travailler quand l'économie rouvre et il faudrait que tout le monde retourne au travail?
Bon, premièrement, précisons qu'il y a des changements importants qui se passent. La subvention salariale a commencé lentement, pour des raisons que je pourrais décrire plus tard si vous le souhaitez. Donc, la subvention salariale a commencé lentement, mais elle procède à un rythme accéléré depuis déjà quelques semaines. Il y a autour entre 2,5 millions et 3 millions de travailleurs canadiens qui, présentement, sont appuyés par la subvention salariale de 75 %. L'autre changement important, c'est celui sur la prestation canadienne d'urgence. Il y a un nombre important qu'on estime à peu près, je dirais peut-être un 20 % de Canadiens qui ne reçoivent plus maintenant la prestation canadienne d'urgence parce qu'ils n'en ont plus besoin, ils sont retournés au travail. Et on s'attend qu'avec le déconfinement, la croissance économique qu'on a déjà commencé à valider avec les chiffres de Statistique Canada il y a 10 jours, on s'attend à ce que ces deux tendances continuent à s'accentuer. Mais vous avez tout à fait raison, la prestation canadienne d'urgence doit s'ajuster pour faire davantage de place à la subvention salariale et à d'autres mesures éventuellement pour que, comme vous l'avez aussi dit, les effets de désincitation qui étaient exactement les bons au début ne soient pas maintenant en opposition à la croissance économique et à la création d'emplois. C'est effectivement la désincitation au travail qui n'était pas un problème au début, mais qui va le devenir tranquillement. Cette désincitation au travail soit de moins en moins importante, même s'il est utile d'un point de vue social, pour laisser la place à la croissance économique et un rôle plus important pour la subvention salariale.
D'accord. Merci. Donc, vous dites que la PCU doit s'ajuster pour faire plus de place à la subvention salariale. Donc, on doit comprendre que dans la prolongation de la PCU qui va être annoncée dans quelques jours, on ne parle pas seulement de changer de date ou de nombre de semaines auxquelles on va avoir droit. Il va y avoir aussi des critères qui vont changer.
C'est à voir, mais vous comprenez là, que ça fait partie évidemment des discussions. Je ne veux pas répéter à nouveau, mais la situation ayant évolué beaucoup, la prestation canadienne d'urgence et les autres mesures doivent aussi évoluer.
Merci, Monsieur le Ministre. Thank you, Mr. Minister. Kevin?
National News. My question here has a little bit of a government
focus and perhaps a public health focus, but it does have to do with the CERB. But part of the issue that is a challenge to encourage Canadians who have taken advantage of this, have used this program, let's not say taken advantage, have used this program because of the serious circumstances that we're in. Many are have serious concerns about returning to work for a myriad of reasons. Perhaps there are not convinced that the policies at their workplace are up to the public health standards they like to see. They may have or live with someone who is immunodeficient. And in other cases, they may be getting paid more on the CERB than the job that they could go back to will pay them. How does the government meet the challenges to encourage Canadians to leave this program given all those factors, and what public health measures need to be in place for employers and employees to ensure that there is the utmost safety to control any type of future spread or second wave, that sort of thing, to ease the collective minds of Canadian workers as they head back to jobs they may be concerned could increase their chances of becoming infected?
Well, very quickly, because I'll turn immediately to Dr. Tam, because you make a very important connection between the health and the economic conditions. And exactly that. No, at the beginning, CERB was there to connect these two in a manner which we had never thought about, because that was the first time ever that the Canadian government had to reflect upon how to protect the health of Canadians and the ability of Canadians to make ends meet. But now we are moving into a different world, and I'm going to ask Dr. Tam to answer the question.
Yes, so with the Chief Medical Officer of Health at the Special Advisory Committee, a considerable amount of time was devoted to providing guidance for workplaces from the perspective of a risk assessment-based approach. There's so many different workplaces, and each of them are quite different in terms of the actual physical environment, the people who live or work in that environment, and their not just that, but their connection back to their families, who's in their families, whether they're living in crowded conditions, for example. So there are many guidance already provided, and you can find that on our websites. Also working with other sectors, because each sector actually, many of them have got best practices and ways that they are providing all the public health measures that is required at the local and municipal and provincial level. We are supporting the Canadian Centre for Occupational Health and Safety, where for many different sectors, some of these guidance are provided so that they can safely reopen. As employees, of course, you need to talk to your employer as to how they're protecting the health of yourself and the workplace. And the same with the federal government. Right now, we're trying to make sure our workplaces are sustained in a safe manner. Learning and actually capitalizing on some of the positive things that have come out of the last few months is leveraging some flexible work arrangements if you can. Things like teleworking, how to do different shifts and have people come in at different times. So there's quite a lot of ideas and different approaches that employers are using. And so more and more of these tools are available. So having the support for the Canadian Centre for Occupational Health and Safety is meant to try and pull all of that together so that people have the resources they need to return to work safely.
Really, I think this will just focus for you, Minister Duclos, this transition that the government is keen to encourage from the emergency relief benefit to the wage subsidy. Many businesses seem reluctant to join on to the wage subsidy program, and there, again, are a myriad of reasons there as well. There are a lot of expenses for businesses to reopen to meet the public health guidelines. They anticipate fewer customers because of those guidelines, and therefore may not be able to hire back as many workers, or are choosing to scale down, or may not be able to reopen. At this point, there's just a bit more than $10 billion of wage subsidy that has been paid out. Of course, when this program was touted, it was, the biggest public health economic development type program since the end of the Second World War, more than a $70 billion anticipated budget. What more can the government do to encourage businesses to sign on to the wage subsidy, and has its uptake been a disappointment thus far for your department of the government?
Well, disappointment might not be the right word. I would say it's a matter of adjustment. The firms some weeks ago were facing two types of uncertainties. The first one was around the nature of the program itself. Now, it was the first time ever that the government of Canada had designed such a program. And second, firms were uncertain as to their ability to proceed, at which speed and in which manner with relaunching their business and rehiring their workers. So there was an understandable lack of speed initially when that was introduced. Now that is clearing up. I think businesses are understanding better how this system works, and businesses have a better ability to see the way forward, economically speaking. In addition to that, the Minister of Finance, Minister Morneau, as you well know, is working very hard and has received very good pieces of advice from the business and the worker communities on how to make, as you said, the wage subsidies more impactful. And he will have something, I believe, quite good and useful to announce in the near future.
Thank you, Minister. Ceci met fin à la conférence de presse pour aujourd'hui. That's it for today. Thank you, everyone.
Today's press conference. Thank you.